Well, it opened last April to no big celebration or ribbon cutting, just some hard work of a team who felt that it had to be there. While this trial clinic has no official name, it's become known as the Lower Leg Wound Clinic, and it's making some big strides in helping patients with a number of health issues, and now they're hoping for a permanent home. A warning, some of the images in this story may be disturbing. Daryl Rummel reports.
96-year-old Violet Pickering suffers from sores on her legs caused by type 2 diabetes. Early last year, her doctors told her they would soon be forced to amputate both legs. That's when her daughter Mabel Harold went searching for other treatment options.
So she gets to come here every day or every 2 weeks to get it scraped and try and mitigate whatever is going on there for her legs.
There's barely enough room to fit the patients they see, let alone do their work.
Yeah, so this is a space that we had available and we're grateful for it. It's certainly not enough, but we're making do with what we have right now.
Staffed by a doctor, registered nurse, licensed practicing nurses, and a physiotherapist, this clinic operates 4 hours a day, 1 day a week. All of them performing these duties on the backs of their regular jobs inside the hospital.
What we're being able to do is give people quality care, getting the right type of care that they need versus, maybe going to emergency and getting just partially what they need.
Norm Dan suffers from lymphedema. Both legs are swollen, one with an open wound. He's been coming for treatment for months and is steadily seeing progress.
Basically, it has cleared up the wounds quite nicely. This leg is still healing, quite a bit to do on it yet, but this leg is basically, it's done.
Since April of last year, this makeshift clinic located in the rehabilitation wing has dealt with 148 patients ranging in age from 20 to 96.
Typically the highest percentages of what we see is our venous insufficiency wounds are first, and then our diabetic population is second, and then pressure sores tend to be our third.
Dr. Sommerfeld and his team say the trial clinic has been wildly successful. It's their hope that Alberta Health Services will soon see the benefit too and provide funding to continue operating, or at least space in the upcoming building expansion, so patients like Violet Pickering can get the attention they so desperately need. Daryl Rummel, CTV News, Lethbridge.
Similar clinics are operating in hospitals in Calgary and Edmonton.
Good.